How is the burnout affecting the industry?
Well, unfortunately, we're seeing some of our best and brightest leave the industry, just like a lot of other industries. Personally, I know that we need clinical care, but I just from having lived it myself of leaving patient care and starting a technology company and seeing the impact that I've been able to have on our industry, but also again expanding that brand of PT far and wide outside of the usual sort of boundaries that I'm not I don't think it's a bad thing that physical therapists are looking at other avenues in healthcare or even outside of healthcare, as long as they continue to represent themselves as physical therapists, and that's part of the whole brand of how awesome professionals that we have within our industry. Personally, we've hired at WebPT quite a few amazing physical therapists who had great careers, or they were only 1 or 2 years out, and they said, "You know what? I want to impact my industry in a different way. That I just don't see myself being a hands-on clinician. I want to use my clinical knowledge in a different way to actually give back or benefit potential patients or even my peers as providers within WebPT in technology jobs. The more we have representation in other areas like hospital administrators as PTs, even in the political arena, people working at CMS who are physical therapists. Like we really lack a lot of representation because there's been such a dearth of healthcare providers that, and the mindset going through PT school is that you're going to come out and be a clinician. You're going to be the best clinician you can. And while that's all wonderful and great, and I think that we need the best clinicians out there, or else again that value wanes, right? If you're not actually having great people deliver the physical therapy care. But I do think it's an opportunity to expand the visibility of the great therapists and professionals that we have in this industry. So we're losing some talent, right? Clinical care talent. But I don't always, like I said, I don't think that's necessarily a 100% a bad thing. But we do an industry report every year called the State of Industry Report. And last year, the results showed that nearly 50% of all rehab therapy professionals feel more burnt out today than they did pre-COVID. Pretty indicative. It's not unique to us as healthcare providers, right? Your personal life definitely bleeds over into your professional life. And we know all of the factors that, having to deal with kids at home and juggling, being sick, not sick, family members, if you have, older family members who you're feeling very stressed out about, maybe even lost, members of your family or your friend group. I mean, it's been a really tough few years. And so, how that's affecting practices. We know we're seeing wage pressure, just like many other industries where, unfortunately, though, that's really hard because revenues, again, this all comes back to the business side, right? You top revenue coming in, it's hard to pay your employees more when you don't have more revenue coming in. We have the student debt issue, which is one of the biggest factors to burnout. The cost of our education is not commensurate with what our salaries are within our industry. It takes a very, very long time for people to pay off their student debt. And so one of the ways that it's affecting, though, these are pressures that we feel in our industry. There are people that are now coming out and trying to solve those in different ways. By challenging and changing our educational system in trying to develop new programs that shorten the time frame in which you're in PT school, which lowers your cost of education, and also different technology, ways to improve your workflows within practices, like we talked about before, so that you're not having to do as much of that administrative component, and therapists who want to get back into clinical, who are doing clinical care, really focus on that patient and provider interaction more than they have to do with the actual administrative work. So